Hello everyone. Hi. So we are going to wait for people join us tonight. I don't know if you guys can hear me good. Please let me know. I cannot see the comments, and neither can pin anything for some reason. So today we are going to be talking about World's AIDS Day, and Whitman-Walker is offering free HIV testing by appointment only. You can give us a phone call at 202-797-4439, and we are here to help you to schedule an appointment for HIV and STI testing. So, as you know, my name is Lissa Alfaro, and I am from Whitman-Walker Community Health Department. And tonight we are going to talk about Worst A, and we are just waiting for some more people join us. So we are going to start with some words, saying that World AIDS Day is celebrated every year, and on this day, December 1st, provides an opportunity for people worldwide for unite in the fight against HIV, support individuals living with HIV, and remember those who have died from the illness. Since the first appeared in the early 1980s, 75 million people have become infected with HIV, and 33 million people have died of AIDS-related illnesses. So, in recent years, the new medical technology have turned HIV from death sentence into a choice chronic disease. But the virus still range on it 2019, an estimated of 38 million people around the world were living with HIV. Many of those people don't know about their status, and people don't have access to care, and therefore we have a difficult time preventing against the spread of HIV around the world. So during this live, we are going to honor towards a day by talking the importance of knowing your status, and by discussion option for prevention and treatment. So people who is watching us, if you can send us direct message to our page, because we are doing the live video without seeing who is comments or saying anything in the live. So I'm sorry about that, but we are going to continue with the topic. So what it does mean for people who know your status? Why is it important to know your status? So knowing my status means knowing about all things sexual health. It means regular HIV and STI testing and communicating with my partner, so that we can be fully transparent with each other about any possibly health issue. So it's important to know your status so that you can prevent the spread of illnesses and take care of yourself personal health. So as I told you in the beginning, Whitman-Walker is offering HIV and STI testing by appointment only. Everything is for free. You don't have to be worried about pay anything. So you need just call us at 202-797-4439 to get an appointment with us and see some of us to talk about maybe any question you have about it, and we can help you to do anything related with HIV and STI testing here at the testing room area. Actually, I am here one of the room, and the location in Northwest Washington DC, and use the important letting you people know the importance to do the test every 3-6 months. So now, how can I encourage my partner to check their status? So I usually just ask the person I am being intimated with to get tested with me, and make me date to do it. So if you can also share the fact statistics around HIV/AIDS, hope that by sharing that necessary information is encouraging them to get tested and know their status as well. As I told you, it's the important if we are having sex with people, is if we are we want to know their status too. So that's why we encourage our people around us to get tested unless every 3 months to know their status. So how condoms are effective and way to prevent against HIV. When should I use them? How do I talk to my partner about using them? So you should always use a condom even if you are in a relationship, because they are an effective way to prevent against HIV. Letting your partner know that this is important for you to feel safe and comfortable in sexual acts with them. So it's the best way to start the conversation, and it's a big fan of trying to make this conversation fun. So maybe even having a variety of condoms, flavors, latex, no latex, etc. So can help turn the conversation into the foreplay. Always remember to stand up firm in your boundaries, no glove, no love. So it's important to know if we are with a partner, make sure we have the conversation about this important topic. This is important, and to know about HIV and STI, and the importance is to use condoms and lubes, to have better sex when we are with them. So also today we are going to be talking about PrEP and PP, and what are they, how they can change the way that we think about HIV prevention. So if you are comfortable speaking from honest perspective, so what have you been using experience with the HIV prevention? So let's talk about some ways to manage better our social health. And to start, we're going to start about PrEP, and it stands for PrEP exposure prophylaxis, whereas PEP and stands for post-exposure prophylaxis. So as you already know, PrEP is a prevention method that greatly reduce anyone's chance of becoming HIV positive before any possible exposure to HIV. So also when taking when you are starting PrEP and you are taking the medication, and you are taking the medication every day, it can be at least 92% effective at stopping HIV transmission through sex intercourse. So also similar to birth control, but for HIV. So remember, this is just like a pill to I say, birth control is just a pill, one pills a day. And if, as I told you, 92% effective at stopping HIV transmission to sexual health, sex through sexual intercourse. So also, what is PEP? And it's a 28-day course in the antiretroviral medication ART that can prevent a person from becoming HIV positive after possible HIV exposure. So it must be started within 72 hours of recent possible HIV exposure. So it should only be used in emergency situations where someone think they were recently being exposed for HIV through sex or needle sharing. So similar to Plan B in the morning after pill, full but for HIV. So I mean, we are going to if we have an exposure and we think the person told us he is HIV positive and he didn't tell you at the beginning, he tell you after finish having sex with that person. You can use call us and make an appointment is super easier. It's super easier now to get because it's in person, like we used to do it before. So it's simple. You can just call us at 202-797-4439 and we can use help you. The steps are super simple, and as I told you, it has to be 72 hours or as soon as possible, or 72 hours after exposure. So it's super simple. It's super simple to get it, and you can just give us a phone call. If you want to know also more about it, you can just call us at 202-797-4439, and we are here to help you with anything you need about related with HIV, condom, HIV, STI, PrEP, PEP, and also counseling. So the ability and availability of PrEP and PEP have been changing the way that we think about prevention in a couple of ways. So one, before PrEP PrEP, the only option for HIV prevention was condom usage. So PrEP allows us to further this discussion and provide patients with multiple options to prevention HIV transmission. So also, post-exposure prophylaxis or PEP has also helped the community in the sense that it's now an option for those people who have think they have been exposed to HIV. Before, people would have to wait, continuously testing and see if they will become infected. So these are both extremely advanced since the epidemic originated and over 30 years ago. And as I told you, it's like a PrEP is like a birth control and PEP is like a plan B. So it's super easy to get it. And what does treatment as prevention mean? So treatment as prevention is a concept in public health that promotes treatment as a way to prevent and reduce the HIV illness, so death or transmission from an infected individual to others. So expanding access to early HIV diagnosis and treatment as a means to address the global epidemic by preventing illness, death or transmission was first proposed in 2000. So the terms is often used to talk about treating people that they are currently living with human immunodeficiency virus or HIV. So an immunodeficiency syndrome AIDS to prevent illnesses, death, or transmission. So we are going to talk now about indetectable, equal, intransmissible. So what does that mean? For people who doesn't know, U equal to is an informational campaign about how effective HIV medication are in preventing sexual transmission of HIV. So U equals U means indetectable, means intransmissible. So indicating that if the person with HIV is on HIV medication and with consistently undetectable for HIV. Viral load, the virus cannot be transmitted to sex to other people. As a preventing strategy is often related to as a treatment, as prevention or TAPS. That is treatment as a prevention. Yeah. Also, remember equal use and TAPS are based on substantial scientist data. In fact, to the U.S. Center for Disease Control or Prevention, or CDC, have said that people who taking ART daily as prescribed and required to maintain undetectable viral load had effectively no risk of sexual transmitting for two virus to an HIV negative partner. So, unfortunately, I cannot see the comments. I don't know neither who is watching us, but as I told you, if you or someone has any question, to you can use make a message here at the Whitman-Walker page, and we can just help you, over this way. So just remember, today we were talking about World AIDS Day, and the important also to know about our status, and encourage people to get tested every 3 months in or 6 for HIV and STI. Is a good way to be healthy and have our loved ones healthy as well. So just a little reminder for people who are watching now, knowing your status is one of the best ways to stop the spread of HIV. Whitman-Walker can help to figure out what's your HIV status through our HIV STI testing services appointment at our location 1525 in Northwest, and also our MRC location in Southeast DC. So to make an appointment is super easy. You can call us at 202-797-4439. You can also access SUPREP services by calling 202-939-7690, and our PEP services by calling 202-797-4439. So if you are newly diagnosed with HIV, also you can call us at 202-797-4437, especially around this holiday, where many people are used to traveling. Make sure that you stay at least 6 feet away from other people when possible, wearing a mask in public, avoiding places with a large crowd, encourage work from home if possible, speaking with loved ones on the phone, over FaceTime instead of in person. So social distancing is to care to you and your loved ones, and also our community. So stand up to date local, state, and national guidelines for testing, quarantine, and general safety. So also a friendly reminder about washing your hand for less 20 seconds at a time, and staying home if you don't feel well. So also, again, thank you so much for watching us tonight. And also reminding to follow us on Twitter, Facebook, or Instagram, and to stay up with the day with the team that Whitman-Walker posts every time. So thank you again, and for being with us tonight, and happy Wednesday. Take care. See you next time. Bye bye.